And parents began to ask questions and say, it's unacceptable that our children don't have at least some opportunities in the community. Let's see. Uh-oh, I think I messed this up. Go get the tech guy for me.
Just gonna escape.
Press this instead of this. So, I love this younger generation. My grandkids know more about technology than we do, which is a good thing. So in 1960, Kennedy was elected President of the United States, and that was very important for us in our work because he had a sister with mental retardation. Her name was Rose Marie, and she lived in one of these private institutions all her life in Minnesota, and he is a key figure in community programs in our work. This is his sister, Eunice Kennedy Shriver, in the middle. She founded Special Olympics, as you all know, and she passed away a couple of years ago. But Kennedy did some things. He actually began to talk about this as a national problem, or national issue that we had to deal with. And he created the President's Panel on Mental Retardation. It still exists today, and it's like a think tank that has access to the White House on issues that we have to deal with. And they recommended, brought some money to the community. They passed the Mental Retardation Construction Act, some child care projects, and started vocational rehabilitation. And keep in mind, this was all very experimental and very limited. I know when I worked at Pacific State Hospital, which was built in the 1920s, I had an office kind of spread out in the grounds there. And hospitals were always built on huge, expansive grounds, normally. Camarillo was built basically to house people from Los Angeles, primarily with mental illness. And I grew up in Ventura County, and it was surrounded on three sides by mountains full of cactus and rattlesnakes and coyotes and things like that. And it was 60 miles from LA. And the city of Camarillo didn't even exist when it was built back in the 30s. When I grew up in Ventura County, Camarillo was, you know, one of the, where did you go to school? Camarillo, or where did you get your driver's license? You know, it was a very derogatory kind of term. So Kennedy began to do things, and when I worked at Pacific, let me finish my story, I had this office which was an old converted Quonset hut, but right next to it was this brand new two-story brick building. And the people who worked in there came and went. They really didn't have much to do with the hospital at all. And I asked the director of social work one day, I said, what's that building for? And she said, well, that's actually part of UCLA, and it's funded by the federal government to do research on mental retardation, and they would use some of the people at Pacific, but it was part of this Reconstruction Act. Okay, we're moving right along. 63, there were 13,500 people in state hospitals in California and 4,000 on the waiting list. So even though the only thing we had were these large institutions with very crowded, unsavory conditions, people were still, you had to wait. I mean, if you made that choice, that horrible choice, to place your child, you had to apply, and basically all you got was placed on a waiting list. So Vivian Walker, who was the chair of the ARC of California, got a reporter from the Orange County Register, and they went to Fairview State Hospital, and there was this huge expose in the Orange County Register about these horrible conditions in this state hospital. And this one here is really important because this guy, Niels Bank Mikkelsen, who was an internationally recognized expert in our field from Denmark, went to Sonoma State Hospital, that's a picture of Sonoma, and said, in our country, we wouldn't treat cattle like this. So this was very damaging information. Sonoma is that way. It's still open. It was built in the 1850s. There are about 400 people remaining there. It's recently been in the news. Has anybody heard or read about that? a staff member was using a taser on the patients or the clients.
Wow.
It was just horrible, horrible thing. It's actually being investigated by the U.S. Department of Justice. Yes, sir, what's your name?
My name is Pete.
Pete, what can I do for you?
I used to be in Sonoma State Hospital, not anymore.
Yeah, when you were a kid, you lived at Sonoma State.
Really?
Yeah, yeah.
You like it in the community better?
Yeah.
Good for you.
Yeah. There are a few people that used to live at the state hospital.
So what happened, this is a picture of the first Governor Brown. He was governor of California in the 50s and 60s. He's the father of our current governor. And he actually was a very good governor. He did a lot of good things in California. He's the governor that built the state college and university system. If you ever drive down I-5 and you see all that water that's being channeled, the California aqueduct system, he did that. And he was very proud of his infrastructure projects. And he was very proud of his state employee workforce. And this was very embarrassing to him, these exposés of these horrible conditions. And so he went to his state managers in the Department of Mental Hygiene, which ran the state hospital, said, this is horrible, this can't be happening in my state. What can we do about it? And their response, well, we need to build more institutions so we can take care of this waiting list. And that's where this story gets interesting. In 1966, there was a bill, AB 61, that created two programs, one in San Francisco and one in Los Angeles. And these were pilot programs. And Frank Lanterman, the name synonymous with the Lanterman Act, was instrumental in getting this. He said, I'm not sure that building more of these large institutions is really the best thing to do. They're horribly expensive, even back then. Horribly difficult to maintain. Like today, the cost of keeping somebody in a state hospital is about $350,000 a year. The per capita cost for someone to be in a community-based program is about $15,000 a year. So that's a huge, huge disparity. So these two programs were started in San Francisco and Los Angeles, and they were in the State Department of Public Health. Now this is really critical because they didn't go to the Department of Mental Hygiene. They said, we want to look at another way of possibly dealing with this problem. And so these two programs were charged to look at folks on this waiting list and to see if there were any opportunities that we could offer these families something in the community. And this was the beginning of the regional center system. I remember in Ventura County, Dr. Richard Koch, who was the director of Children's Hospital of LA, he would come up there once or twice a month, and families would go in there and bring their kids, and they'd get some speech therapy, and they'd get some medical assistance, and basically a little bit of hope. This is Assemblyman Lanterman. He was a Republican, very conservative Republican from Pasadena, bachelor all his life, never married. His father was a physician in San Francisco that treated victims of the earthquake in 1906. And so he had kind of this social service, community participation that was instilled in him from his family. And he lived, when he was in Sacramento, here. This is the Senator Hotel in downtown Sacramento. It's actually recently been remodeled, and that's where he lived.